in 2008, there was a big legislation passed by the city government in Atlanta to make it easier and more tax efficient for filming. So a lot of the film production that was in Los Angeles started migrating over here. So there's been a big uptick in not only productions here film wise, but also we have Tyler Perry Studios where a lot of his filming goes on. We're considered now the Black Hollywood. That's the unofficial title for Atlanta.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Today, I'm speaking with Dr. Aaron Fletcher about his area of expertise, aesthetic procedures for men. Before we start the show, I want to let you all know about two upcoming events. First, we're having an open house at Glow Medi Spa in West Seattle on Thursday, September 26th from 4 to 7 p.m. And I'll also be appearing at Paper Boat Books, also in West Seattle, on Thursday, October 10th at 6:30 p.m. for a book signing for Med Spa Mayhem. If you're in the Seattle area, I'd love it if you would stop by. I hope you enjoy this conversation. Hi, this is Dr. Kate D, and I'm here today with Dr. Aaron Fletcher. He is a ENT surgeon in Atlanta, Georgia, who is a facial plastic surgeon, and he originally grew up in Washington, D.C., went to college at Morehouse, and then medical school at Temple University in Philadelphia, did his internship at one of the Harvard hospitals in Boston, and then an NIH research fellowship at the University of Iowa, which is really impressive, then residency in ENT in Iowa, followed by a fellowship in facial plastic and reconstructive surgery and cranial-based surgery at the University of Michigan. So thank you so much for being here, Aaron. And that is a really impressive resume. How long was that from start to finish, from medical school through all those years of education and training?
Yes.
I'm like
Thanks,
trying to add that
thanks
up.
for having me. Yeah, I appreciate the opportunity to come on and talk about aesthetics. I really love this field and this topic. So my training was actually 12 years after undergrad. So that includes medical school, residency, my fellowship training, my internship, my research time. So 12 years. Yeah.
It's a really
Went
long
by
time.
like that. Yeah.
Mine was 10, and I'm a little older than you. So for me, I missed the 90s, like the entire decade. I started med school in 1990 and finished my fellowship in 2000. And to this day, people ask me stuff about the 90s, and I'm like, I think I missed that.
Yep. I can
Yeah.
totally relate.
So in your practice, you were telling me that you have really seen a very large percentage of men doing aesthetic procedures in your practice. So I was really curious to be able to dive into that because your percentage, I think you said, was like 40% of your practice is men.
Yeah.
So
Somewhere around there.
yeah, and that's really high compared to the rest of the industry. So tell me a little bit about that. Tell me the kinds of procedures that men in particular are interested in, and we can go from there.
Yeah, I was doing a little bit of research before the podcast. I think in the last maybe 20 years since 2004, there's been like a 30% uptick in men pursuing aesthetics procedures, whether it be Botox, hairline replacement, liposuction, you name it. And most practices, I think somewhere have about maybe 20% male participation in their practice and their aesthetic offerings. I think mine's probably somewhere between 20 and 35 conservatively. I think a lot of that just has to do with Atlanta, but there's a lot of men that are seeking out aesthetic services that have a lot less taboo than the average man that's looking to blend into where men fall in society as far as their aesthetics. But I definitely think Atlanta is a market where there's just a lot of people who are interested in enhancing their appearance, whether it be there's a very big hair market here. This is like one of the hair capitals of the world. People come here for fancy hairdos, hair weaves, stuff like that. And so that sort of attracts a certain demographic. And I think the men that are here as a part of that, which a lot of those patients are consumers for aesthetic services. So that I think has a lot to do with the ratio that I have in my practice.
And I think you were saying that there's a lot of Hollywood in Atlanta. Can you
Yeah.
like I plays the role?
Yeah, certainly. So I think just like you would associate Beverly Hills with plastic surgery, I guess ever since the 90s, they used to have Beverly Hills 90210 and these other doctor shows, doctors in Beverly Hills fixing people up and extreme makeover and things like that. The entertainment industry attracts a lot of plastic surgery patients potentially. And so in 2008, there was a big legislation passed by the city government in Atlanta to make it easier and more tax efficient for filming in Atlanta. So a lot of the film production that was in Los Angeles during that time started migrating over here to Atlanta, and it was from 2008 onward. And so there's been a big uptick in not only productions here film wise, but also we have Tyler Perry Studios where a lot of his filming goes on. And we're considered now the Black Hollywood. I guess that's the unofficial title for Atlanta,
The Black
among other
Hollywood.
branding. Yeah, Black Hollywood. So there's just a lot of actors, actresses, entertainment. There's a big music scene here as well, especially with hip hop and R&B. And as a part of that, there's just a lot of people in the industry that are looking for enhancements or just to get camera ready or to be more prepared for filming opportunities and things like that.
That makes a lot of sense. And I imagine that affects the culture of the city as well. People are maybe a little more put together in Atlanta than they are in Seattle. I
Yeah.
hate to not to put down my home, it's not exactly my hometown, but my chosen town. We're still living in the world of grunge up here in the Pacific Northwest. So
Yeah,
a little
for
bit
sure.
different mix. It's interesting. So, what kinds of procedures? I'm curious to know both on the surgical side and also on the non surgical side. What kinds of procedures are you doing specifically for men that seems to be more common?
Yeah, I think nationally, the number one procedure that men pursue is rhinoplasty. So that's certainly within my realm of expertise. I do a lot of nose jobs. Some of them are not necessarily cosmetic. Some are functional. People that have had trauma to their nose or are having trouble breathing, or if they have a deviated septum, or if things are crooked, either from the way they were born. Those are typically things that men seek out. Rhinoplasty, number one. Number two is blepharoplasty, eye lifts, usually the upper eyelid. A lot of men coming complaining of being tired looking or just wanting to look more refreshed and youthful. And so that's a really big, I would say that's probably my top three because I just do facial stuff majority wise. On the non-surgical side, I would say Botox fillers. I get a decent amount of men looking for Botox, not as much as fillers, I would say, but I do have some regular Botox clients. There's a procedure called buccal fat removal, which has actually become more popular, I would say, in the last 5 to 7 years, where we remove the buccal fat from the cheek. That's commonly known as like the baby fat that you can't exercise off, and it causes the face to be a lot more rounded and not as sculpted. So I have a lot of men, particularly in the last 2 or 3 years, coming in to have their buccal fat removed, and that usually creates more of a chiseled kind of appearance.
Uh
It's the
huh.
cheekbones more prominent, and people that are looking for that model sculpted lower face with a strong chin. That's like a
Hmm.
look for people who are in.
That's really interesting. I imagine that you probably don't have very many women at all who want that.
Correct.
Not only do we don't really need the chiseled look, we always think of fat as preserving youthfulness, especially as we get older.
Yeah.
I may be slightly chubbier than my younger self, but I think it makes me look a little younger.
Yes.
At
Yes.
56, I'm like trying to hold it all together here. I've
Yep.
not had any kind of surgery, and I don't have filler in my face, but I think so. But it's really interesting. So as men do that kind of procedure long term, do you see any downside in the end of losing that volume or not really?
Some people say it accelerates the aging of the face. You do look a little older because you're basically removing your baby fat from your cheeks. As you age, you'll have a little bit more of a gaunt, kind of thinner appearance to the lower face. It works well in the short term for people
Yeah.
who I had a client who was looking to get into modeling, and I think that procedure really is what made him successful because it gave him that
Right.
sculpted look. We combined that procedure with the chin implant, which kind of gave the overall effect of kind of being just that masculine, sculpted, Brad Pitt
Hmm.
kind of dimple type of thing. So that I
Right.
think is a lot of men are going for that. But like I said, the downside is you're going to look a little bit older in the short term, and you
Hmm.
won't have the fat, like you said, that is a signal of being more youthful. Maybe 5 years from now, you may wish that maybe I would have left some of that fat. For the short term, it's
So,
actually being really well received.
so I'm curious, did that patient end up getting modeling jobs after
Yeah, yeah,
having
yeah.
that?
He's actually, if you open any Ralph Lauren catalog right now, you'll see his face in there. I won't say his name, but he's one of the more
Wow.
prominent models for a Purple Label, and he's
Hmm.
doing basically campaigns for all the big sort of fashion houses. And I think he's actually getting into acting now. It worked out well for him. Ever since I've shown people his pictures, it's actually got me a lot more business because people are looking to get that same effect. And so I think that's the niche population is men that are looking for more of a sculpted look. But I haven't had, to your point, many women interested because it does accelerate the aging of the face and stuff.
Yeah, and I think that's pretty well known. Like our patients are pretty well informed, and so one of the questions we get is, will RF microneedling negatively impact my fat? And we'll have, how do you know we're not going to diminish the sub-Q fat? And we have a device that's very careful that delivers energy just in the dermis, and in the right hands, we won't touch the fat at all. But I think people know that they're not supposed to mess up their fat in their face. So it's a really different it's a different world when you're talking about men, because so I think that you can age and you look more distinguished, but you may be more wrinkly. The example I think is like Harrison Ford. He's still so handsome, but he's pretty darn wrinkly. I think he's in his 80s now. Yeah.
Yeah, yeah, he's up there. Long way from Indiana Jones.
I know, but that's the thing is he hasn't really, needed to do anything. He's still a handsome guy. Whereas with women, we really, if you're that wrinkly, it's really hard to still be acting, I imagine.
Right.
Yeah. So I'm curious. So, this isn't really specific to men, but since you have a very different experience, have you seen any complications of either that treatment or any of the other ones that you do, and either of your own or of other places that are doing stuff down the street kind of thing?
Not in my patient base. I've obviously there's a learning curve with everything. I know some surgeons. I saw an article maybe about 2 or 3 weeks ago with a prominent plastic surgeon who's in the media a lot, who said that he actually stopped doing buccal fat removal because he was seeing a lot of complications. The main one being damage to the facial nerve because we're working on
Oh,
the facial nerve is there.
uh,
Some people, their buccal fat is not the same amount on each side. So you may remove one side and it might be way smaller than the other side, or there may be some
mhm.
significant asymmetry. So that typically that can turn into unfavorable result. I haven't really seen it happen. Hematoma is another potential complication of this procedure because there's a hollow space that's left behind when the fat is removed, and that can sometimes fill up with fluid or blood, and that can lead to lumps and things like that. But that usually goes away, usually by 2 to 3 weeks.
Okay.
Yeah,
And
those are things that
how do you do it? Is there a scar
you
do you have to
actually
make
just reach
incision?
inside the cheek. It's like a dental procedure. A lot of people do it under
Okay.
local anesthetic. Put a little bit of local. I do a combined local right inside the cheek, opposite the second molar, and we make about a 1 to 2 centimeter incision, and we just dissect down through the soft tissue, and it pops right out, and it starts to actually almost come out of the wound because there's a capsule around it, but once you rupture that capsule, the fat just pours out, and it's easy to pull out in one little glob. And
Okay,
it
interesting. And do
might
you
take a stitch depending.
ahead of time, is there any way to tell if there's more on one side than the other? Can you look first
No,
before you
it's
suck it out?
not. You can't really tell until you get in there. And
Okay.
actually, a lot of people end up over resecting because it's not just one piece of fat. There's actually different lobes to the whole buccal fat area. So you're only supposed to take one portion of it, but some people end up taking the whole thing. And that can really draw the cheeks in and make you look older. So you have to
Yeah.
be really careful. There's a certain artistry, and you have to be very judicious about how much you're removing. And that's something that you just learn by doing it.
And can you see the nerve? Can you, like, make sure you're avoiding the nerve or
Yeah, it's not really visible in the dissection, but if you get a little bit too deep and a little too high, you can either hit the facial nerve, one of the branches of it, which can make
Uh,
part of the face a little paralyzed. And then the other thing is the parotid duct, which is right above where we make the incision. If that were to be transected, you can actually cause a buildup of salivary fluid in the cheek.
yeah, that would be a problem. So the parotid gland is a salivary gland in there that you definitely don't want to mess up, and the duct
Correct.
is the little tube where the saliva comes out. And so that you have to be really careful. This is, of course, why you need a really highly trained facial plastic surgeon to do this.
Yeah,
This is not something a cosmetic surgeon with a weekend course could do, right?
correct. Correct. And I
Okay.
actually started doing the procedure under general anesthetic when I first did my first few. Now I can do it under just local with the patient awake. But obviously, if you're going to be fumbling around, you don't want to have the patient awake. So I made sure I had my technique down solid before I started doing it in the office because
Mhm.
there's
And
certainly a learning curve.
and so now you're able to do this in an outpatient surgery center or just in your office? How long does it
Yeah,
take?
just in my office, really. It takes about, each side probably takes about 10 minutes, 10 to 15 minutes. I
Wow.
liken it to a dental procedure. If you were getting a filling, you'll
Uh,
have your mouth open and we'll be working in and out of the mouth. Just it's no different than having a dental procedure once we get down
sure.
to it.
Sure. What about, do you do the hair stuff or no, not in your
I
clinic?
don't. I've always entertained it. I think it's a great industry. There's a huge demand for it here in Atlanta. There's a lot of
Mhm.
people that do hair, but when you do hair, you have to do only hair because it's such a demanding population. It's usually professional men. A lot of those men are in front of the camera, weathermen, urologists, news anchors, what have you. Those are the people
Okay.
with hair plugs, and so they want to make sure it's perfect. And if you're going to be all over the place and not doing it very regularly, you're going to have some trouble with those patients because there's a lot of demand. So I don't do it. I usually refer that stuff out. I've got a lot of understanding on how to do it, but I just didn't want to dilute my practice
Yeah.
habit.
I think one of the themes throughout this podcast is that as physicians, we very much feel like we have to be an expert at the thing that we do, whatever that is. And so we don't, if we just can't do something half-assed, right? Like we just have to just know we're doing the right thing. And I think that the industry that we've both ended up in, very different parts of it, but is filled with a ton of people doing it where they don't really have that training. They don't really have that experience. They go to a weekend course and they say, "Oh, let me offer this now." And when it's some minor thing that can't really harm anyone, I guess I don't get that upset. But when it's a big deal like cosmetic surgery, that's really problematic because the consequences of something going wrong are so enormous.
Yes.
So, like you were saying, even this other ENT, famous person we won't mention, they're giving that up because they don't want to take those risks, right? You have to really be an expert on knowing where is the facial nerve and how do I not
Yeah.
touch it and how do I do
Yeah.
this delicately so that there's no harm. And so I would love to just ask you what your fellowship was like. So in the past, on a few episodes, we've talked about the difference between a plastic surgeon, a board certified plastic surgeon, and a facial plastic surgeon. So someone who's done ENT, so a full otolaryngology residency, followed by a plastic and reconstructive fellowship. Those people are generally referred to, like you, as a facial plastic surgeon. And then there are oculoplastic surgeons who did a full residency in ophthalmology and then a fellowship in facial and reconstructive surgery. So, yeah, so those are all very legitimate, very highly trained surgeons who can do really careful surgery on the face. And then, of course, plastic surgeons do the body as well. And there's a real huge number of people who do some sort of cosmetic surgery training of some kind and then call themselves a cosmetic surgeon. And those courses could be days to weeks to sometimes I've even found out about one year cosmetic surgery fellowship, but those are not board certified. They don't have the kind of training like you've had 12 years. Most plastic surgeons have around that. And can you comment at all on that or what's going on in Atlanta? And have you come across People portraying themselves as plastic surgeons who are really not.
Question. I don't even know if I could tip the iceberg, but I will say Atlanta has had some very high profile examples of people pushing the borders of their training. We have emergency medicine doctors that are doing quote unquote aesthetic surgery, which includes lipo, BBLs. We had OBGYN surgeons who are trying to do plastic surgery, opening up plastic surgery practices. So I think it's harder and harder to distinguish if you're a regular consumer who's got the goods as far as training. Board certification even is something that is supposed to be a standard, but even that, you can have board certification and still be very unqualified to do cosmetic surgery. So I think the main thing, it's like the Wild West out here, especially on the non-surgical side. Anybody can get, like you said, a weekend course, get certified and pick up a syringe and start going to business, going to town, right? So I would say I think it's a critical importance to look up your surgeon, not just on their website, but do background on the medical board to see if there's any complaints that have been filed. Look at before and afters. Even those can be misleading. There's some
Yeah.
people really shady things with their before and after. But you'll see a volume of good work in someone who's actually qualified. Look at patient reviews. Those can also be misleading. You can buy reviews now, so even that is not as robust a safeguard as you would like it to be. But I would say do your research because there's a large number of people who are trying to get into the cash aspect of medicine because of what's happening with insurance reimbursements, and it's just harder and harder to make money as a doctor the traditional way. So everybody's trying to add different ancillaries, whether it be Botox, fillers, liposuction, to try to bolster their bottom line. And that's it's actually hurt the legitimacy of the specialty, I think. We have that a lot in Atlanta. There's a few, if you just look up Atlanta and just cosmetic surgeon arrests, you'll see a whole bunch of different
Hmm.
articles pop up, people losing their license, people filming inappropriately in the OR. There's just been so many examples of people trying to expand the boundaries of their training. And there's a reason that I went to school for so long. Working in the face is very high stakes. You only get one chance to do it right most of the time.
Yeah.
It's not like liposuction where you can put on a baggy sweater or baggy sweatpants and get through life without people seeing the horrific result. But when it's your face, you only get one chance. If it's your nose, you don't want to mess somebody's nose up. You don't want to have facelift looking crooked or their eyes looking off. So this is something that you really want to make sure you got someone who's trained in it. Board certification is critical, but you can also, like I said, look at the Georgia Medical Board or whatever state medical board and just look up the doctor. I
Mhm.
think they have ways you can look into past complaints, lawsuits, and things like that.
Yeah. I would say that I would add that um, if the person is calling themselves a cosmetic surgeon on their website, don't go there because they're not a plastic surgeon. They know they're not allowed to call themselves a plastic surgeon because that's false advertising. So that's one big thing, right? There are some cosmetic surgeons who do have plastic surgery on their website. So they're basically lying. So now you've got to look them up. So you've got to look them up and figure out if they're really a plastic surgeon. So look up, are they board certified by the Board of Plastic Surgeons? And then, of course, the ENT and ophthalmologists who do facial plastics, you can look those things up too. And we've provided links to look up all these things in the past, but I can put those in the show notes so that people can just go straight there and say, "Oh, I wonder if that surgeon who did my eyes was actually legal." You can look it up. It's actually that part's really easy. The other stuff about before and afters, those are hard because it's so easy to doctor that stuff now. You can just use AI and take a picture of you or me and make us both look better and then use that as a before and after, and you've done
Right.
nothing.
Right.
There was recently a case, there's a local ENT here in Seattle that I talked about. He was sued by the attorney general because he was doctoring before and afters, and he was also threatening patients with suing them if they wrote a bad review, and he had a bunch of fake
Oh, I
reviews.
saw that. Yeah, that was pretty high profile, actually. He got a
Did you
huge fine.
really?
Yeah, I think I saw that case.
Yeah, he's still in business. He paid a bunch of money. It was a big fine. I think it was like $5 million, but
Wow.
he's still doing it. So I'm assuming he no longer forces people to sign NDAs and stuff. But in general, when you're looking at before and afters, it's so hard to know if that's real. I think, yeah, it's hard. I think that besides a person's credentials and being able, I do think reviews are very helpful because I think fake reviews usually look pretty fake. One of the reviews that this guy in Seattle did, I read a few of them and it was like, oh, this was so great. And I got such great results. And at such a cheap price, it was only blah, blah, blah. And I'm like, that's basically an ad, right? People don't really write about
Right.
that or like
Yeah.
that way,
Yeah.
But it's really hard to trust the sources of information. Yeah. I'm curious because you mentioned when we talked one time before this recording that there are a lot of medical tourists, and you had seen a fair number of people going to other countries for various surgeries. I'm sure it's much cheaper in a lot of other countries, although you got to pay for airfare and hotel.
Yeah.
So I'm imagining that adds to the cost. But can you comment? Are there certain countries that are actually doing that well? Or are there other countries that are butchering people? What's the status on
Yeah.
that?
I've never had any work done. I've never been overseas, just to say that. But yeah, there's a big difference in price for things like hair transplants specifically.
Hmm.
I know Turkey and South Korea are the two hottest markets for hair transplant. And that mainly boils down to the technicians that put the hair grafts in being significantly cheaper in those countries than they are here. That's usually where the markup occurs, is the labor to actually insert the hair grafts. And they pass that savings along in their pricing, and they usually will package it with hotel, flight as one package. I know South Korea is
Wow.
doing some amazing work. I've seen people who've come back from there, and I've seen people do YouTube videos where they vlog their experience. And
Huh.
a lot of people don't know South Korea is really the number one plastic surgery market in the entire world right now.
Really?
Yeah, I didn't know that. Someone actually told me that a couple of years ago. I would have assumed maybe Brazil or Colombia, but South Korea has
Interesting.
the most plastic surgery in the world per capita. They've really
Wow.
made an effort. I think when you step off the plane in Seoul, they have like kiosks where you can go and book and inquire about cosmetic surgery tours.
Really?
So they've really made an industry out of it, and it's
My
actually
God.
worked to their benefit if you're willing to fork down the money and be willing to go on a plane across the world for a surgery. But I've seen one guy who went to Turkey for his hairline. They actually did a buccal fat on him, and his hairline looks amazing.
Mm.
He's telling everybody, look, if you're going to get this done, you're going to save maybe $10,000-15,000 versus.
Wow. Wow. I don't actually know what the going rate is for hair transplants. I'm sure
Yeah,
it
it can be
depends on
expensive. It
big
can be in
right.
the high five figures, mid to high five figures, depending on if you use a technician, a human technician, or if you use a robot.
Uh-huh.
And that's the state of the art here, is to use the robot. But you can still get a great result with the technician, but you're just going to pay the American markup compared to a place like Turkey or South Korea.
Uh-huh. Interesting. And have you seen any kind of downside of medical tourism elsewhere?
Yeah, I've had some patients come in with some botched work. Implants in the nose is a big thing in the Far East. Korea, they do a lot of these silicone implants to
Uh-huh.
create a bridge in the tip of the nose, and those usually end up pushing through the skin after several years. They look great in the
Oh,
beginning, but I've had to fish a couple out that were extruding through the skin. And once you're in
wow.
another country, some doctors won't even touch your case, which is one of the big downsides. Is you have to find a surgeon that's willing to go in after somebody else and accept all of the risk that's inherent to that. And so that's, I think, the biggest part of it. You won't get back to your original surgeon with your complications.
Right. I think actually would be really interesting for our audience to hear just a little bit about noses because as a non ENT doc, I do not touch noses at all. And I have one ENT, that local person in Seattle, she will do non surgical rhinoplasties with filler under
Mhm.
ultrasound guidance. And then she also does rhinoplasty. So I feel like she's the only person I trust to do it properly. And then, God forbid, you run into any issues, she can deal with that. Can you explain to people like why the nose is so delicate and why the blood supply is so delicate? Like, why do we worry about messing the nose up? Or there's some famous cases of people whose noses completely collapse. So you maybe
Yeah,
can comment it.
yeah.
Why does that happen?
I think the short answer would be that it has a combination of tissue types. So you're dealing with skin, you're dealing with muscle, you're dealing with an abundance of blood vessels. The blood vessels come in both sides of the face. There's a robust blood supply to the middle of the face because the nose is the center of everything. Not just the blood flow, but you're dealing with muscle, cartilage, bone, all three or four. And you need to be able to know how to handle each one of those tissue types. And that's something that you don't really get just by studying anatomy. You actually have to get the
Yeah.
tissue in your hands. You have to know what you can do. You have to account for the healing process, which is a lot longer than most people realize with the nose because the skin is very thick in certain parts. And so it's prone to scarring, it's prone to swelling long term. And I think a lot of surgeons who are very competent below the neck won't touch a nose, even if they're very talented, because it's just a very specialized expertise. The beauty of training in ENT is that we do a lot of surgeries that are not cosmetic on the face. So we get a lot of experience at handling the nose, the face. When we do a parotid surgery, we're doing the same incision and dissection as a facelift. So I probably did several dozen parotids a year in my residency, and I trained for 5 years. So that cumulative experience of working with those tissues gives me more confidence that I've seen just about everything in those areas. Whereas if you're doing a plastic surgery training, you may get a sliver, maybe a few months with a person who's dedicated to the face. And then you may just have to go get the rest of that experience in your practice. And then obviously it's right in the middle of the face, it's a central aesthetic unit. So you're not going to look at someone's face and miss their nose. A lot to be careful about.
I interviewed a little while back a patient who had filler. Actually, it was an ENT who injected Radiesse, and he was injecting the nasolabial folds and hit a major branch of the facial artery. And she lost half her nose. So she's
Wow.
scarred from her about here down to there. And she has a nasal prosthesis. And I would love to hear your opinion, but she got a couple of opinions, and she was basically told because the blood flow had been so compromised that any reconstructive surgery wouldn't have taken. Have you seen that for people?
I haven't
Probably
seen.
not from filler, I'm guessing from
Yeah,
trauma.
it's one of my least favorite areas to do filler. One, because I think people overestimate the impact of a nasolabial fold filler. Usually when people come in and they want filler in that area, they're like, "Oh, I want to do this." And I'm like, "That's a
Right.
facelift, right?" So they want to obliterate that rather than blend it. I always tell people you're going to blend it, but it's still going to be there. But
Sure.
that network of blood vessels there is so I lay awake at night worried about hitting that. It's one of my dreaded, hopefully never occurring complications. But that I think that area, the nose has a lot of blood flow from both sides. Some of it is collateral, meaning it goes across. But once you lose a major branch, it's pretty much lights out for that tissue and there's no recovery.
Yeah.
So it's a dreaded area to have a complication.
Yeah. And I think also for, our audience, both Aaron and I are up at night worrying about this kind of thing because we know the how awful that complication would be. And I can tell you that the people without all the million years of training don't. They're not up at night worrying about this because they don't know it's a possibility. They're like, it's never going to happen. If you do enough filler, you'll get a complication eventually. And if you're really good, it'll be few and far between. But you have to be ready to treat it. You have to be prepared. You have to make sure you're not using any permanent fillers because you won't be able to correct that. And so someone who's up at night worried about you is going to do everything in their power to make sure that they don't harm you at all and that they can fix any complication that happens. And I think that one of the things I've really tried to drive home is you really want that person, even if it's unlikely, the bad thing, unlikely to happen for anybody, but you really want that person who really knows what they're doing, knows the anatomy, and knows how to deal with the complications to be treating you in the first place. And it's hard to discern, right? How do I know that person really knows what they're talking about? So part of it is you've got to look them up and you've got to figure out that they're legal, but also you want to go talk to them and see if you jive with them and trust them.
Yep.
Yeah.
And the
Yeah.
other thing I would add to that is that the non-surgical market, whether it be Botox or fillers or some of these other sort of machine-based treatments, have become so commoditized meaning you can get it on any corner, on any block in any major city. There's someone doing it, maybe two or three people doing it. It's hard to tell what quality looks like because you're mainly based on price. You're looking at location rather than actual skill. And it's become a lot more dangerous, I think, to just fly by the seat of your pants booking these treatments because they're everywhere or just
They
because
are.
they're
And
good.
I was interviewing, I met healthcare attorney, and I said, I think half of the growth of the industry since I got into it 10 years ago is all illegal. And he said, oh, yeah, at least that. And in doing research for my book and the podcast, there are almost, and there will be soon, as many Starbucks as there are med spas.
Yeah.
And because a lot of them are flying below the radar, they don't even have a website, but they're on Instagram. They're being run by unlicensed people. Super dangerous. So, yeah, I think it's a little scary, but that's why I'm here talking to people because I think it's just so important. It's interesting and fun, and there's amazing things that we can do, but there's an equal number of super dangerous things. So that's why I'm trying to educate people. I want to wrap up with just asking you, like, if there's one or two, you don't have to limit yourself, but if there's one piece of advice that you have for people out there who might be listening, what would it be? What would you tell people?
Yeah, I would say keep listening to podcasts like this. I think it's good to get doctors talking to each other from a certain level of competence where we can actually give you the type of advice that may change your outcome or may change the surgeon that you go with or may change your decision to have a procedure at all. I think we need more people actually talking about this in a comfortable setting where we don't feel we're going to be judged or we don't feel like we're going to be putting another doctor down, but we can talk frankly to potential patients because, like you said, I think it's going to become even more Wild West as we go forward because it's just become the barrier to entry is so low right now. And I think, like I said, the climate of medicine, everybody's looking to add ancillaries that'll bring in more money so they don't have to deal with third party insurance. You see a lot of
Mm-hmm.
people creeping, a lot of family medicine doctors. When I go to conferences now, they're marketing devices and treatments to family medicine and internal medicine doctors that they claim are standalone and you don't have to you just delegate it to your PA or your nurse and they can do it and you just sit back and collect the money. I think that's incredibly dangerous. So I think just having some way of vetting doctors and practices and med spas, I think that's an idea that you have that's a phenomenal idea, just creating some type of vetting system where patients can be assured that someone's done the research on what matters because it's hard for a patient to know what matters outside of
Yeah.
price patient. So I think doing your due diligence it pays for itself a million times over, and it'll potentially save you from even a life-threatening complication.
Yeah, definitely. I like one thing that you said is gathering information may affect whether you even want to have a procedure. And I think that if you're going to somebody who is really ethically based and will tell you their honest scientific opinion, their medical opinion, we may very well tell you not to do it, talk you out of it. I talk people out of things all the
Yeah,
time, right?
yeah,
No,
great.
like that's not going to get you what you think you want out of that. And here are the risks of that. And any place that just wants to sell you stuff, I think also I would just, my place, we'd basically educate people, tell them the things that we do, why we do them, why we like them, and then they can decide for themselves, right? So I think that's really important.
Yep.
Is there anything else you'd like to leave our audience with?
No, I've enjoyed it. I love talking about this topic. I got my website up if you guys have questions about what I do specifically or you want to look into some of the things that I offer.
Yeah.
Uh,
Can you tell our audience what's the best way to get in touch with
yeah,
you?
you can reach out through my website, which is www.aaronfletchermd.com. And I'm also on Instagram at aaronfletchermd.com. And both of those have access to my phone number and my website. I take patient inquiries by email and also through my website. And I also
Great.
answer select DMs on my Instagram. So if they're
So,
business
okay, don't
related.
bombard Dr. Fletcher, but yes, he's available. And we'll have those links on the show notes so you can just click right from your phone. Thanks, Erin, so much for joining me today. I've really appreciated our conversation. I've learned a lot. Thank you.
Thank you. And thank you for having me. I enjoyed it a lot. Appreciate it.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website medspamayhem.com. And read the book. Med Spa Mayhem is available everywhere books are sold. Thanks for listening. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Med Spa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.